Welcome to the Expert Series, brought to you by the Lupus Foundation of America. Today's episode is titled 5 Common Questions About Diagnosing Lupus. Doctors face many challenges in reaching a diagnosis of lupus. Symptoms mimic many other diseases. Complicating this is the fact that there is not a single test to diagnose lupus. It can take an average of nearly 6 years from the time people with lupus first notice their symptoms to being diagnosed. Early and accurate diagnosis is important for timely treatment. In this new episode of the Expert Series, Dr. Luis Vila answers 5 of the most common questions health educators receive on diagnosing lupus. These answers, originally in Spanish, were translated and read by Lupus Foundation of America staff. Dr. Luis Vila is a professor of medicine and chief division of rheumatology, allergy, and immunology at the campus of medical sciences of the University of Puerto Rico in San Juan, Puerto Rico. Question number 1. Why can it take so long to receive a lupus diagnosis?
Certainly, the diagnosis of lupus can be delayed in a substantial number of patients. This is because there are many different initial manifestations of lupus and they vary considerably in some patients. Some lupus patients have general symptoms such as tiredness or fatigue, fever, loss of appetite and weight, and headache. Others may have skin rashes or joint pain and inflammation. Inflammation can occur in vital organs such as kidneys, brain, liver, or lungs, among others. Another problem is that many of these manifestations can occur in other medical conditions, which can be confused with lupus. For example, in a patient who has chronic tiredness and generalized pain in the joints and muscles, their doctors may be considering fibromyalgia, but have not considered lupus as the cause of these symptoms. A patient who has a fever at night and has lost weight is being tested for cancer, but not for lupus. In another patient who has multiple sores, swollen and stiff joints, rheumatoid arthritis is being considered, but not lupus. Another example is a patient who has anxiety, depression, memory and concentration problems, and is being treated for primary psychiatric conditions when there is a chance that lupus is affecting the brain. In other words, lupus is the great imitator of many other conditions. All of this poses a challenge for doctors, particularly those who do not have the necessary experience evaluating and treating patients with lupus. Herein lies the importance of an early referral to a rheumatologist. If the manifestations of a patient with lupus are not typical, the diagnosis and therefore the treatment can be considerably delayed. This in turn could cause irreparable damage to the affected organs or systems. Therefore, lupus must be suspected and evaluated promptly, and once diagnosed, treated quickly and effectively.
Question number 2. How is the diagnosis for cutaneous lupus different from the diagnosis for systemic lupus?
Cutaneous lupus, or skin lupus, is limited to the skin, while systemic lupus erythematosus affects more than one organ or system in the body. Skin lesions, such as discoid lupus and subacute skin lupus, among others, can occur without affecting organs or internal systems. However, 3 points must be taken into account. First, some of the lesions of skin lupus may resemble other skin conditions. For example, subacute skin lupus can manifest itself in 2 ways: the classic lupus with red ring-shaped lesions and other that is virtually indistinguishable from psoriasis. Therefore, sometimes a skin biopsy is required to make a diagnosis of skin lupus. Second, a full evaluation of someone with skin lupus is required to verify that it has not affected other organs or systems. Many inflamed organs caused by lupus won't necessarily produce symptoms. For example, a lupus patient may have inflammation of the kidneys or liver, and the only way to find it is with laboratory tests. Similarly, anemia and alterations in blood components such as white blood cells and platelets do not necessarily cause symptoms. Third, someone who has skin lupus may develop systemic manifestations of the disease in the future. Therefore, they need to be evaluated long-term. At each follow-up visit, you would have a physical exam and your doctor would order blood and urine tests. As mentioned earlier, early identification and treatment of systemic lupus could prevent irreversible damage to the body's organs and systems.
Question number 3. If a person has several common symptoms of lupus but does not have a butterfly rash, can they still see their doctor or should they wait until they develop it?
The butterfly-shaped rash on the cheekbones and nose is known as malar erythema. At the beginning of the disease, malar erythema occurs in about 1/3 of patients with systemic lupus erythematosus. Therefore, most, or 2/3 of people, do not develop this symptom at the onset of lupus. The skin rash is just one of many manifestations a person with lupus can have. If a person has symptoms or suggestive manifestations of lupus, whether or not he or she has malar erythema, he or she could see their doctor immediately for a full evaluation.
Question number 4. If a person has several symptoms of lupus, but the ANA is negative, does that mean they don't have lupus? What is the ANA test and what is it used for? Can a person be diagnosed with lupus despite having a negative result?
Lupus is an autoimmune disease, that is, the immune system, whose function is to attack infectious microorganisms and cancer cells, turns against itself. That's the concept of autoimmunity. Through this process of autoimmunity, in lupus, many antibodies are formed directed against different cells and tissues. One such antibody is ANA, which stands for anti-nuclear antibodies. These are directed against the components of the nucleus of cells. ANA is one of the criteria included in all classifications that have been developed for the diagnosis of systemic lupus erythematosus. Most patients with systemic lupus have a positive ANA test, but up to 5% have a negative ANA test. This occurs mostly in Caucasians and those patients whose lupus begins at later ages. On the other hand, it should be noted that a positive test of ANA does not mean one has lupus. This test may be positive in patients with other autoimmune conditions, such as Sjogren's syndrome, rheumatoid arthritis, polymyositis, dermatomyositis, scleroderma, and hypothyroidism, among others. In addition, it can occur in patients with infections, and even healthy people may have a positive ANA test.
Question number 5. What can a person do while their doctor investigates what their symptoms might mean?
The most important thing at this point is for the patient to follow the physician's instructions and recommendations regarding blood tests, radiographic exams, referrals to other specialists, and subsequent reevaluation appointments. In addition, if your doctor has a high suspicion of lupus, they may recommend treatment with medications while the recommended tests and evaluations are being performed. To help someone throughout the evaluation process and until a definitive diagnosis is reached, he or she should seek support from family and friends and learn about the disease. Finally, I recommend that patients ask questions and clarify any doubts with their doctor.
We thank Dr. Vila for his answers to questions on the diagnosing of lupus. We invite you to visit the National Resource Center on Lupus, where you will find useful information and guides on diagnosing lupus. To connect with others who are in the evaluation process, you can check out the Thematic Conversations on Lupus Connect, an online support community for people with lupus. Thank you, and have a wonderful day.